Hi, my name is Seth. I'm a second-year nursing student, and today I'll be performing 2 injections. One's a subcutaneous, and the other one is an intramuscular injection. So the first thing I'm going to do is introduce myself like I did to my patient. I'm going to be identifying who I am, what level I am, or what area I'm working in, and what I'll be performing today. I'm going to be checking the MAR to ensure that it's complete, correct, and all filled out, and it's comprehensive and accurate. And then I'm going to be checking that the medication, it follows the 8 rights for the patient, the right patient, right medication, right reason, right dose, right route, right time, frequency, and site. I'm also going to confirm if there's any allergies. In this case, Mario Mancini does have an allergy to codeine, so I just have to make sure there's no codeine in any of the medications, which there is not, which is good. Then I'm going to ensure that the proper doses I'm going to be giving to the patient does match his appropriate build, his weight and his height, and his muscle size. Once I gather that information, I am then going to be identifying the needles I need for this situation. So the first thing I'm going to be doing is looking at my 3 ml syringe, and this is going to be for my subcutaneous injection for 1 ml of heparin. You usually pick the smallest syringe you can, but in this case you also need room for air, so that's why I'm picking the 3 ml syringe for this 1 milliliter injection. Then the next one I'm doing is the intramuscular, and this one I only need half a mil, so I'm using a 1 ml syringe, which gives me enough room for air as well. I'm going to perform hand hygiene now, and just wait for this to dry. So the next thing I'm going to be doing is assembling the syringes and needles. First thing I'm going to do is grab the plunger from the back here, holding it up. I'm going to open the packaging a little bit more here so I can grab the base of the needle here, holding and twisting to lock it in place. And I will place that there for now. And I'll be doing the same with the other needle. Making sure just to grab the plunger, opening it up enough so that I can grab the base here, and attaching them like so. And perfect. So now that they are attached, I'll be opening the vial here and my ampule. So when opening the ampule, you need to make sure you're opening it away from yourself. Hold it firmly and snap. It should be a clean break. And I will just place that here like so. Make sure there's no glass or anything. And normally I would have a fill needle that I would use to withdraw the solution, but in this case, since we do not have a fill needle, I'm just going to assume that I would have one on. I would withdraw the proper solution, make sure that I get all the solution in the vial, switch off the needles to the actual proper injection needle, and use it. The gauges for the needles, I would have already checked to make sure that the gauges are properly fitted. So for the needle for the 3 milliliter injection for the sub-Q, it's usually, according to Potter and Perry, anywhere from 25 to 27 in a gauge size. This one is a 25 gauge. The other needle it can fit in the range of 20 to 25. This one is a 22. So for the first one here with the ampule already open, I am going to open the needle. So what I'm going to do is bend the cap down like so, and pull this off. And I will put this here for recapping after I withdraw the solution. So what I'm going to do now is draw the correct dose, which is 1 ml of the Haldol. Make sure not to get any needle sticks or anything whatsoever. And I'm also going to prime the needle a little bit to make sure there's no air bubbles. And you're going to keep going until you get enough out there. Now, of course, this would be the fill needle that I would have to remove and put on the new needle, of course. But in this case, we're going to just be using this one. And just to recap it like so, I would do the swooping motion like that. And that's so I can move the needle around like so. Next one, I'm going to be just getting the needle ready to take off the cap here. Safe uncapping technique, thumb pressed without using your nail. Opening the needle straight up. I'm going to withdraw the amount that I need in air. And I'm going to inject here, twist it upside down, squirt the air into the bottle, and withdraw the solution. Because I do have some air bubbles in here, I'm going to go probably to about 0.6 mils instead of 0.5. And now, once I have that, I'm also going to prime the needles. Holding it at the end here, you can prime it properly. See the air bubbles going to the top. Pulling it a little bit more past there just to get the appropriate amount of air. And you'd want to make sure, of course, that if you're injecting it, you inject it straight down into a garbage preferably, but if you're half a mil like so, and there you are. Now you have your needle ready. You are going to use the swooping motion with your cap to get the cap back on, and now that it's on, you can close it. And you are now ready to bring your medications to the patient to administer, and you would dispose of any sharps or any materials you have on the table that has excess. And of course, before I would go and administer the medication to the patient, I would label which is which so that I know which medication I am going to be injecting. I would put the labels on the needles like so. Alrighty, so now I'm going to be performing hand hygiene and donning on my gloves. So for this procedure, I would identify the patient's date of birth and name on the wristband with what I have on my chart information. But in this case, we don't have the patient here, an actual patient here, so I'm just going to be explaining the procedure without one. So I'm going to put on my gloves now. So for this procedure, we have two needles. One is a subcutaneous injection of heparin, and that is an anticoagulant, which is used to treat deep vein thrombosis as well as DVT. And the second one is it's a half milligram dose of Haldol, which is an antipsychotic used to treat mood disorders. So for the injection site, the first thing I'm going to do is inspect the injection sites for any redness, mass, or swelling or bruising, anything like that, or any tenderness. So for the subcutaneous injection, you want to find an abundance of fat. That's generally the abdomen region you look for. And it's about 2 to 3 inches over from the umbilical region. And then for the intramuscular injection, it's given to the deltoid. So the way you would do that is, if you lift up someone's arm, you're going to find the cranium, and then you're going to do about 3 fingers down from there, and then you'll find your deltoid. Or if you can, for some patient, get them to flex, you'll find the deltoid muscle there, and that's your injection site. So after you're done your palpating, and you would get your needles primed and ready. So now getting onto the injection itself, I'm going to be administering the 1 ml dose of heparin subcutaneously. The first thing you want to do is get your alcohol swab, and you want to cleanse the site. You're going to be swabbing from the inside or from center out, ensuring not to contaminate anything. And then you're going to take your needle and you are going to uncap it with one hand, place the cap on the side here in case you need to recap it. And because this is a subcutaneous injection, you're going to be going in at a 45-degree angle as so. So you're going to steady the area, inject, stabilize, and inject, and then remove the needle slowly. And then with your one hand here, you're going to hold the needle up and you're going to recap it. And you would dispose of it in the sharps. But in this case, I'm just going to put it to the side right now because I also have my next injection, which is the half a mil of Haldol. So I would uncap that. This would be assuming this is the deltoid I'm injecting into. And because it's the deltoid and it's an intramuscular, I would be going at a 90-degree angle as such. Inject, stabilize, and then remove. And then you would also flip the switch with one thumb up like so. Place to the side, you can dispose of the sharps and supplies. And then you would write down that you have administered the 1 milliliter dose of heparin subcutaneously, as well as the half a ml dose of Haldol intramuscularly, and you will now document that on your MAR.